Playing cricket for India has not only earned me admiration from the people of this great country, but also taught me a lot about life. Be it a test match or one's own health, it's important to know which deliveries to play at and which ones to leave alone. Hello, I am VVS Lakshman and you will be seeing me in a different role today. I am pleased to be here with Dr. Santhilal, an expert in diabetes and insulin management. Insulin, while important to many diabetes patients, is unfortunately surrounded by misconception which patients can often fall prey to, keeping them away from living the healthiest life they can with diabetes. The purpose of this initiative is to ensure that Indian diabetic patients do not get caught behind by playing an outswinger of misconception and rumors about insulin therapy. Doctor, my first question to you is, patients often feel that insulin injections are going to be painful. Is there any truth about this? How would you reassure a patient of yours who has this fear?
Thanks, Lakshman. This is very apt and frequently asked question that we face from our patients. In fact, the truth is, current insulin injections are almost painless. Insulin administration technique and newly developed pens and syringes have traveled a long way. Now they are much advanced and patient friendly. If needles are frequently changed and site of injection is properly chosen and rotated, the patients won't feel any pain or discomfort.
Thank you. Doctor, my second question is, a patient may be nervous about the social stigma surrounding insulin, like taking an injection in public, or may believe that needing insulin is a personal failure of theirs. What would you tell to such a patient?
Yes, Mr. Lakshman, this is probably the most important question. Some of the patients think of insulin administration as social stigma. So, if the patients are fully aware of the benefits of the insulin, they become more confident about insulin therapy. In fact, patients start responding to insulin in a better way once they understand the need of insulin and initiate insulin therapy. So, it is very important to counsel the patients before they start taking the insulin, and then it's much easier from then onwards.
Thank you. Doctor, my final question to you is, people might believe that needing insulin means they can no longer be independent, eat out, travel, or live alone. Would you say there is any truth to this?
On the contrary, dear Lakshman, it is quite the opposite. Being on insulin actually makes patient more independent as he or she can adjust timings of meals and take insulin accordingly. Now with the advanced technology, the patient can take insulin at any time, even during traveling. There are cooling boxes in which patients can keep the insulin and maintain its potency for a longer period of time. So patients can actually have more freedom to eat out, travel or live alone while he or she is on insulin therapy.
Thank you for your time and your input, Dr. Santhilal. I'm sure your insights and expertise on insulin therapy will be of tremendous benefit for the millions of diabetic patients living in India. When you're batting with insulin, it's important to avoid the outswinger of misconceptions for a better inning.